The purpose of this video is to outline the manufacturer recommended process for the routine maintenance and reprocessing of InogenOne systems in between patients. Visually inspect the concentrator, battery, and all accessories for cracks or other significant damage. If case of concentrator is damaged, stop and send the device for service to Inogen or an authorized Inogen service center. If accessories are damaged, bag, AC power supply, and DC power cable, replace them. Disinfect all components of the system using isopropyl alcohol or an equivalent. Plug in and turn on the concentrator by pressing the power button on the user interface panel. Listen for unusual noises or loudness. Hold concentrator and assess for unusual vibrations or rattles. Ensure that the LCD screen displays the setting and percent of battery charge. If any issues are noted, stop and send the device for service to Inogen or to an authorized Inogen service center. Press each of the buttons on the user interface panel to ensure their proper operation. The arrows should increase or decrease the settings. The light button should activate the backlight behind the LCD screen. The bell button should activate or deactivate the alarm. The power button should turn the device on and off. If any of these do not operate properly, send the device for service to Inogen or to an authorized Inogen service center. With the concentrator on, push and hold the bell button until the LCD screen changes. This will display the software version, the serial number, and above them, the life clock. The values to the left of the colon are the hours the machine has been used. This is informational and does not have an effect on the operation of the device. To check the battery, turn the device off and unplug it. And remove the battery. In this order, plug the concentrator in, connect the battery, and check the LCD screen. The screen should say charging and the percent of the charge. If the screen is blank or displays the term battery error, send the device for service to Inogen or to an authorized Inogen service center. Turn the concentrator on and unplug it. After a few minutes, the setting and the battery in hours and minutes should be displayed. Inspect and clean or replace the intake filters. Clean with a mild dish detergent and ensure they are dry before replacing. Be sure to follow these instructions for both intake filters. Change the bacterial filter. This is the final filter before oxygen is delivered to the patient and is located behind the oxygen cannula barb on the concentrator. Using a spanner wrench, unscrew and remove the barb. Using tweezers, remove the old filter and replace it with a new one. Then replace the barb. Inogen sells kits with the spanner wrenches and extra filters. Consult your company's price list. Ensure that the battery is charged at a minimum of 50% prior to redeploying the device. Inspect the AC mains power supply and DC cable auto for damage. Plug in the AC power supply and ensure that the connections are solid and that the green LED is illuminated. If the LED flashes or is not illuminated, replace the power supply. Inspect the bag for wear and cleanliness and replace if necessary. Battery note: when the reprocessing is complete and the system is ready for deployment, it is best to disconnect the battery while the device sits on the shelf. If the battery is connected and the concentrator is off for a period of weeks, the battery will be drained as the battery and concentrator are in constant communication with each other. A battery left in an unused concentrator for more than 3 weeks may damage the battery and reduce its ability to power the concentrator.